Dr. Seth Ali regarding the disorder Lesch-Nyhan. Dr. Ali has dealt with numerous patients with this disorder. First off, Dr. Ali, what exactly is Lesch-Nyhan?
Well, Mr. Eberhard, Lesch-Nyhan is an extremely rare genetic disorder. In fact, it is so rare only 1 in 380,000 babies born are affected with LNS. Lesch-Nyhan is characterized by the lack of the HGPRT enzyme. HGPRT plays a crucial role in the body, and a lack of this enzyme causes a uric acid buildup in the body.
Well, Dr. Ali, what are some of the symptoms of this disease?
There are many symptoms to this disorder, but there are 3 that stand out the most. First, there is neurological dysfunction. What this refers to is impairment of the nervous system. What this does is delayed development, decreased muscle tone, and a lack of speech in the early ages. The second symptom, and the most common, is overproduction of uric acid. This causes crystals of uric acid to be excreted from the human body. The last symptom, and the most severe, is self-mutilation. What this is biting of the lip and tongue, which later progresses on to headbanging and finger biting within the affected victims.
So, if a person were to have Lesch-Nyhan, what would their general lives be like? Describe it to us.
Well, their daily lives are constantly obstructed by this disorder, and the average life expectancy of someone with Lesch-Nyhan is early to mid-20s. However, with the proper physiological care, they can live to much older. But throughout their entire lives, they have poor motor skills, and uric acid crystals are constantly being excreted from their body. Also, they always have involuntary muscle movements, which include headbanging. Even worse, they never learn to walk, and few live above the age of 40.
Well, what methods can be taken to treat this disorder?
There are a few methods of treatment for this disease. First, affected victims can wear protective devices such as straps and splints to prevent self-harm. Next, they can take the drug allopurinol to lower the amount of uric acid in their body and return it to normal levels. And lastly, recent studies have shown that this gene is a good candidate for gene replacement therapy. However, there is not enough research to effectively execute this method of treatment.
Thank you for your time, Dr. Ali. Next, we have geneticist Chase Williams, who will go into more in-depth analysis on Lesch-Nyhan.
Thanks, Isaiah. My name is Chase Williams, and I've been researching at Johns Hopkins for about 5 years on this challenging prospect of researching the Lesch-Nyhan Syndrome. As you can see here, this is the HGPRT enzyme. It is a very large and complex protein. What it does is it helps in the creation of purine nucleotides, which it does through purine salvage pathway. As you can see, this genetic disorder, the Lesch-Nyhan Syndrome, is X-linked recessive. While females can be carriers, it is males who are the recipients of it. 1/3 of all receivers of this genetic disorder, however, are caused by new mutations. This means that when the egg cell and the sperm combine, there's a mutation. The HGPRT enzyme is coded for an HPRT1 gene. That gene is located at XQ26 to XQ27.2 region. This is consisted of 654 base pairs, and there are about 9 exons and 8 introns in there. During the Lesch-Nyhan syndrome, there's about 300 point mutations, primarily deletion. This means that the entire gene is rendered useless. That means that the HGPRT enzyme cannot be coded for, thus leading to Lesch-Nyhan syndrome and all of its symptoms. Back to you in the studio, Isaiah.
Thanks, Chase. Now we will go into a promotional video of Lesch-Nyhan Syndrome. geneticist Chase Williams. Thank you for tuning in to this episode of Daily Geneticist.
Oh yeah, who knows?
Oh my God. Hey, let's go.
Daily, what was that? Illuminati? Because you're looking at the kids. Alright, let's restart.
Type of treatment for this disease. 4 words, man. Come on.
Treatment.
No, you gotta alleviate it. Are there any methods for alleviating the symptoms
Because-
of Lesch-Nyhan
because
syndrome, you know?
The Strapping twins aren't treatment for